I am Dr. Heather Moore. I have my lovely assistant Jeff with me this evening again. So we're going to go over tonight 3 ways your cell phone is going to lead you to surgery. And I'm not talking about the radio, whatever, something coming in causing cancer. I'm talking about legitimate ways that and things that you do every single day on that cell phone that actually will lead you to surgery. And a lot of times it does because it's prolonged and it's not something that's going to happen overnight. So this is stuff that we're going to go over that you're going to get away with for weeks, months, years. And one day your body's going to be like, not anymore. So kind of heed these warnings. I promise you, if you do all these things, you will be in surgery. There's no doubt about it. And the worst part is that a lot of these things do not happen in isolation. So there's a lot of times that, a couple things you're going to see us go over tonight is going to be combined with other postures and things. So it's really going to compound what's going on with the cell phone. Cell phone use, if you can get yourself away from your cell phone, like if you're sitting there right now watching this on your cell phone, recommend just put it down and walk away. It's probably for the best anyway. But the more time you spend on your cell phone, the higher risk you are for injury. I know that sounds weird, but you are really putting yourself at risk for injury using these devices as often as we do for as long as we do. Little fun fact, if you spend 30 minutes a day on social media, which I am sure most everyone is guilty of, just 30 minutes is 3.5 hours a week. So just kind of put that into terms of what you're putting your body through. Most of us don't work out for 3.5 hours a week. So when you're surfing social media or I don't even know because I don't partake in half of it, but if you're, on social media for 3.5 hours a week and you're in these postures, that's basically 3.5 hours that you're trashing your body. So we're going to go over kind of the top 3 things that we do on our phones right now. So the first one, which is my favorite, and I catch people doing it all the time, is your neck. So it's going to lead to surgery on your neck, and it could be your shoulder, but this is Jeff demonstrating how I see so many of you talking on your cell phone. This morning in line for coffee, I actually saw someone driving with the steering wheel and holding their phone like this. So I can't actually go through how many problems this is causing right now. Shoulder, blood supply, nerve impingement, herniated disc. I mean, seriously, just take a sledgehammer to the side of your neck. You might wind up better off. All right? This is in no way, shape, or form what you need to be doing when you're talking on your cell phone. Get a Bluetooth headset, put it on speakerphone. All right? The other way that people like to do is they just like to hold it up to their ear. Now, when they get on this long conversation, this shoulder starts to shrug, their head starts to lean. So while you don't wind up holding it, you wind up doing the exact same postures that you do when you do actually hold it. So your neck is tilted, your arm is elevated. Now you're aggravating your shoulder, your wrist, your neck. Headaches? Anybody ever get a headache? Guarantee you it's from doing this, all right? So Bluetooth headsets, speakerphone, something along those lines is going to make a big difference. If your fingers ever go numb and tingle, that's the reason why. And it doesn't take an hour-long conversation. Most people I see with their phone up to their ear generally wind up shrugging their shoulder within the first 2 minutes. Or they move their head over. They make some sort of compensation because their body's just not designed to hold their arm in perfect posture and stand up straight for as long as it needs to. So if you wind up with numbness and tingling, you wind up with neck pain, shoulder pain, anything, headaches, it's from doing that, all right? And yes, the headaches go away, and yes, the numbness and tingling goes away, but there will come a time when they don't. And that's when you wind up in this office, or if you're lucky, you only wind up in this office. If not, you're on to surgery. The next one is one of my favorites, and we have really seen a sharp uptick in patients that we treat with this and people who are getting injections, chronic pain, they're going through surgery, and this is your fingers. And I'm not talking about all of them. I'm specifically talking about your thumb. how many of you wind up crossing your finger all the way over to try to scroll, swipe, type, whatever it is, okay? A lot of you, and I see this happen in here all the time, and I will be the first one to call you on it. We'll take a break, and I'll see you rub your thumb out, or I'll see you crack your thumb or something, just to get relief, okay? That's a problem. When you should type, yes, as much as a pain it probably is to type and type and type with one finger, that's better than making your thumb go in all different directions at all times. You really want to be careful with this. Now, the phone that Jeff's using is actually a little bit more of a normal size, but he's bringing my phone up to the screen, which is one of the bigger ones. And I got into this habit myself, and now I can't actually type going across the screen. So I have to make sure that I am doing either the voice. All of the iPhones come equipped with voice, which works out okay. You do have to make sure you check it before you send it. But use the voice or use one finger. Voice is preferred. All right? But you will wind up with pain in your joint, pain through your hand, pain down into your thumb, even into your wrist. And I know a lot of you out there right now listening are nodding your head because you probably should be in here because your palms, your hands wind up sore at the end of the night. It's because of how much typing that you do on your phone. All right, and the next one and the final one, we're going to call your upper back, but it's really kind of your neck and your upper back. So, how many of you find yourself in this position? At least once, 20, 1,000 times a day. Okay, there is no way to check your phone without being like this. All right? You are now herniating all your discs in your neck, in your back. You are now causing your shoulders to slump forward. You are now causing a fantastic amount of problems for yourself. Okay? And this is how we are for probably close to 3, 4, 5, 6 hours a day if we added it all up. Again, anybody suffer from headaches, ears ringing, hands and fingers go numb and tingling. This is a really bad way. Now, who's going to stand there with their phone and put it right up in front of their face, which is where it needs to be? No one. I get it. All right? But how you can back this is you don't sit on your phone for more than 5 seconds at a time, okay? Now, I say 5 seconds, and I know, yes, I am kidding, but you limit the amount that you sit on your phone for no more than 5 minutes at a time. I know if there were daggers, people would be shooting them at me right now, but that's just the reality. That's what your muscles can handle. Your muscles are not designed to sit in this position. Your ligaments in your neck, your shoulders, it's not designed to sit like this. And then you're asking your fine motor, which is your fingers, to work as hard as they possibly can, typing and stretching and all these other things. You really want to be careful about these things. Cell phones are not good for you in any way, shape, or form. The more you can eliminate them, the better off you are going to be, the healthier you are going to be. And that's not even from just a physical standpoint, that's from a mental standpoint also. So if you have numbness and tingling, headaches, if your fingers ache, if you wind up with fingers that are tingling and you think it's carpal tunnel, it's probably not. It's probably due to your cell phone. Really pay attention to that small little device that causes so many problems and brings so many people into this office. If you want us to check up and see if you are using the correct cell phone postures, I'm going to post a link so you can sign up for one of our free consultations. We'd be happy to take a look and see where you're at risk for surgery or where you're at risk for injury. Because many of you, if we could be proactive and get it in here and get you a couple of exercises to prevent some of that, it'll save you a lot of time and money in the long run.